All right, hello everybody. It's Mick. So we're going to continue our talk on suicide here today. Let me grab my notes. In the last vlog, we did general information and some statistics. However, before we begin, I made a note that I owe you the toll-free number for the suicide hotline. That number is 1-800-273 8255. Okay. Now, if you're a veteran, what you want to do is press 1 when you get there, and they'll send you to somebody that's familiar with Veterans Affairs, and they'll help. That number again is 1-800-273-8255. And it's also handy. I keep in my phones to have the Poison Control Center in your phone. So I'm going to give you that number too. And that number is, let's see here, 1-800-222-1222. That's 1-800-222-1222. Okay? So, yeah, please have those numbers in your phones. So I carry it around. So let's get into this here. As you can see, I didn't really get that organized before getting everything going. I'm sorry, but I'm here. So this series that we're going to do, it's it's divided into three vlogs. Okay, so the last one was the first one was general information, about suicide. But today what we're going to do is we're going to discuss suicide prevention. And then lastly, hopefully in about a couple of weeks, I can post a vlog on suicide intervention. Now, you may be asking, what's the difference between the two, prevention and intervention? This is me. I'm going to give you what I think. But prevention can be considered helping actions that are taken prior to the suicide attempt. And this is while the suicide ideation is ongoing. Now, if you remember what suicide ideation was, from the last vlog, it's, that's that. And it's really suicide ideation is a preoccupation with thoughts of suicide. So, it's just starting. But today our vlog on prevention will focus on warning signs and how best to intercede and help. Now, intervention is when a person is in the throes of suicidal intent. Suicidal intent, if you remember, means someone has a plan. They have a plan and they have the means there, so they're ready to go, and they've already decided to carry out the act. Now, I want to emphasize safety for the person that either is helping to prevent or is intervening. Okay, it's safety for yourself and the safety of others. You got to remember the suicidal individual, for the most part, is unstable. Okay, thus they're unpredictable. So don't bet you or your others' lives, even well-being, on what the individual may or may not do. Okay. I think one of the questions, when you get involved in prevention or in intervention, that you have to already have answered and firmed up in your mind is what are the actions you're willing to take? What are you willing to do or not do when it comes to helping someone avoid suicide? And, hopefully one of those things will not be putting yourself or others at risk for suicide. That's something to be avoided. So what I want to do is, I want to do a quick recap on the last vlog, real quick, some statistics here. Some things that we talked about. I think that's important to keep repeating over and over. So it's one person dies by suicide every 11 minutes. Okay, they complete suicide. This includes 23 veterans every day. Now, mental illness is the biggest driving factor. It's a 90% statistic concerning those suffering in that. And they're suffering from depression and or substance abuse, alcohol use disorder, what we label it substance use disorder and alcohol use disorder. I'm sorry, it's a little early in the morning. And previous attempts are the biggest indicator. So you got factors and you got an indicator. Factors are the mental health, and the indicator is 80%, if I remember correctly, were the previous attempts. Yeah, I'm gonna get organized here in my mind. Let me pause real quick. All right. So just to square that away is again, I'm going to say the biggest factor or the factor is mental illness, and that's depression and substance or alcohol use disorder. Along with that, they do it excessively, and then 80% is the indicator. The indicator is that they've already attempted it. Okay, and women are 3 times more than likely than men to attempt suicide. But men, they complete it 3.5 times more. It's higher than women, and that's because of the lethal means that are used with men. They tend to use firearms or hangings or those things. So, but go back if you want to listen to that, please. It's the general information. So, another point I want to bring up is that suicide is no respecter of social, economic, racial, ethnic, or age class. Suicide is an option for all of us. When you really boil it down, we all have that choice. So a person has free will, to take their life. And that means everyone, every day, has a choice of suicide. But for that one who's going through this tremendous inner struggle, it doesn't have to be today or that day. It can wait for tomorrow. And when tomorrow comes, it does not, have to be that day. It can be again tomorrow. And we do that, sort of ad infinitum as I talk with them if they're really in that intent phase. So that's what we call self-limiting because their nervous system can only take that stress so long before it shuts down. So we just make sure that it's not today. Okay. Another thing, there are many reasons for suicide, as there are suicidal individuals. So you got to remember that their reasoning is based upon individuality. But there's also this Buddhist saying that everyone is like all others, and everyone is like some others, and everyone is like no other. So, just keep that in mind. There are things we're going to teach that are pretty generalized and apply to everyone, but you're going to have those times when it's just, it's got to be individualized, if that's even a word. So you got to make the switch to, making that individually appropriate for that person, okay? In that. So is what I wanted to say. Now, what suicide is, I know I defined it last time, but for somebody who's just watching this for the first time in the series, suicide is a predetermined intent to kill oneself, to take one's own life, whether it's on purpose or not, which, of course, I explained in the last vlog, whether some things are on purpose, some suicides are not, but yet it's still there. There's that intent there. The matter at hand is if someone has adamantly or emphatically decided to take their own life, little can be done to prevent that, but still, we'll always try and intervene and help and try to prevent it and those things. researchers have determined that there are basically three reasons for suicide, and I agree with these. It's communication, control, and avoidance. Okay, and when you look at these really fit. The communication approach is when they, from a communication standpoint, for the person who commits suicide, is to let others know exactly how unbearable their pain was, and they did not have that ability to communicate it to others in a reasonable sense, either because people would not listen, or they just didn't have that ability to tell others, of their psychological suffering. The second message is one of control, and that's really control for one's own fate, you know, or to control the actions of others too, or maybe even to seize control of the world when they feel like it's just spiraling out of control. And so it's that is the aspect of the control. Now, just because someone doesn't want to communicate or seems like things are out of control doesn't mean they're going to do it. I'm just saying when suicide is attempted or completed, okay, it's for that. And the last one is a message of avoidance. And what that entails, it's, they want to avoid future pain, future suffering, or even perhaps some negative circumstance that's coming up. And I think in those foundational aspects of suicide, that for people, foundational what's going on, I'm going to talk about that. So I just want you to understand these are the three, and it can be more than just one. It could be a combination of two or more. Okay, on that. All right. I want to make clear my thoughts and how I see the difference between suicide prevention and suicide intervention. And I know I said this earlier, but I really want to drive this home. Prevention is when that person is in that ideation stage. Okay, meaning it's on their mind and they're having thoughts about its viability and it being a solution. During this phase, we will see sometimes, but not always, signs or indicators that the person is going into a dark place. Parasuicidal acts are examples. Talk about what parasuicidal means and what it is. Where a person feigns or perhaps rehearses the act, just to see who pays attention, perhaps. Or again, it's from a communication, control, or avoidance strategy in that respect. But now on the other side, to be intervention techniques are used when the person is in the throes of suicide, okay? Meaning they have decided it is a viable option, they have a plan, and they have the means to carry out that plan. I've been informed of last minute phone calls by the loving survivors where, their loved ones have called them, but just before the incident occurs, or, that moment that they've had that face-to-face conversation before that person commits, the act. Okay. So, with anyone who is contemplating or attempting, just remember, I want you to remember three words. Okay. And, and this is so important. This is all about being human, and that's connection, connection, connection. And, we connect by actively listening. I don't have time to get into what active listening is, but you can kind of look it up. Just look it up and it'll tell you. Uh, our jobs when dealing with anyone in whatever phase they're in is to get them settled, what we call, regulated, and handed off to a professional. And when I say handed off, that's literal, okay? Take them, stay with them, and as best you can. Don't take them at their word on that. Okay. So prevention. Let's start talking about prevention. The easiest way to know if someone is thinking about or planning suicide is to ask them. That's right. Just let's be frank about it and ask, are you planning on killing yourself? Now, believe it or not, most will be relieved. They are, uh, because they're going through this process that's very stressful for them. And asking this question like this, in no way encourages or somehow makes someone more likely to attempt or complete the act. I'm very direct, and I will ask, "Are you planning on killing yourself?" Straight out, I do that. I know psychologically the word kill has a greater impact on our nervous system as opposed to saying the word suicide, and it causes them to be jarred a little bit. You may have noticed, or experienced a little quick uptick in your sympathetic nervous system when I just asked that question by using the word kill. Plus, I use the word plan as opposed to thinking about. Okay, some places will teach to ask, are you thinking about suicide? Okay, I'm straight out and said, are you planning on killing yourself? See, I want to know right then and there where they are on that spectrum, this spectrum of action. It's what we call immediacy, in my profession, in the mental health profession. Okay, so if a person says yes, they have been planning, then I know they're beyond that suicidal ideation, and they're taking concrete steps toward that. And it's hard for them to backtrack and claim they've just been thinking about it. Okay, so just in that way is what I wanted to let you know. It's okay to be very direct and to be a little forceful in the words. Okay. So remember, the easiest and surest way to know is to flat out ask someone. Now it might be hard for you to ask it that way as to post. Are you thinking about suicide? Yeah. They may have already decided to carry it out, and they're longer thinking about it. So they may answer no. So that's why I ask her. Are you planning on killing yourself? Okay. And that. So okay, signs. So the signs of someone contemplating suicide, there are many. They're manifold. Remember, for every reason there's an individual for that. Okay, so there's many reasons as there are individuals. Yeah, but we have some of these related sort of indicators. Remember previous attempts and mental health issues like substance, alcohol abuse, and depression, and isolating behaviors. They're key indicators. Okay. Uh, Also, you don't hear this a lot, but um, bipolar, it has a 4-time increase in suicide, and the reason is while they're in this manic stage, some may act it out because they don't want to go through another depressive episode. So since we mentioned depression earlier as part of it, I do want to go through that. So let's go through that. Uh, Now, there are 9 criteria listed in the DSM-5. Okay, Diagnostic Statistical Manual for Mental Disorders, 5th edition. And a person has to meet 5 of the 9 criteria for at least a 2-week period. Now, I don't expect you to memorize all 9, but I just want you to remember 4, okay? To me, these are the 4 most important. And the first one to me is the most important. And I see this in every person I deal with that I diagnose with depression, major depressive disorder, and that's the loss of pleasure. Okay. what we call anhedonia, and it's a loss of pleasure. Especially in those things that used to give them a lot of pleasure. So if grandma is not coming around or spending time with the grandkids, to me that's a formidable sign. If someone who loved to fish and hunt or do outdoor things or golf, and they're not doing those things, that's formidable to me. Okay. The second is either insomnia or hypersomnia. That's sleeping, way too little or way too much. The third is concerns eating, their diet. Are they eating too much, especially high starch or sugar, or are they hardly eating anything? Now, when it comes to not eating enough, if you suspect anorexia, or even on the other side, the bulimia with purging, it's crucial. It's crucial you do something to connect them and get them help. This is to me, this is textbook control mechanisms, and statistically, it is a leader for suicide. Anorexia nervosa and bulimia with purging is just it's it's a textbook control mechanism, and it shows really a lot of it just shows a lot of pain, and statistically, we see a lot of suicides within these groups. Okay, number four is a problem with concentration or clear thinking. This cognitive interruption. They may seem preoccupied, or in their own world, and can't fully grasp what's being said. Uh, some people have described it, that they're in this fog, and researchers feel that from this what we call a diminished serotonergic neurotransmitter system, it has a lot to do with depression. So this reduction in serotonin, it affects sleep, it affects appetite, mood, and cognitive abilities. So to me, these are the big four. Okay, loss of pleasure, sleep disturbance, whether too much sleep, insomnia, too little sleep, appetite change. We've got anorexia, purging, or they're eating so much starch and sugar, and then these cognitive abilities. And these are easy to see in others that if you know them, you can see them pretty readily. You can tell when someone is not getting enough sleep or too much sleep. There's signs in the face. There's bags, dark circles, or puffiness from too much sleep. We have weight loss or weight gain. There's not showing up to things that used to be fun and exciting. That they isolate themselves socially. And for some, you may have to repeatedly, in the cognitive sense, you may have to repeatedly say the same thing, or maybe in simpler terms for them to understand, where that used to not be the case. Or you may just notice that their problem solving skills have diminished. Okay, for that. So those are what I consider the big four, and I'd like to kind of just remember those and put those in the back of your mind. Okay. Depression and substance alcohol abuse uh, typically go hand in hand. If someone who regularly uses or drinks but begins to abuse it, it'll be noticeable. And the aforementioned four signs or criteria, they can also come from substance and alcohol abuse. Also, those things that I talked about. So just be on guard. So that's sort of this foundational sign or signs a little bit. So I'm gonna switch gears here a little bit. Okay, I'm staying with my notes. So I want to tease something out here that may be heard from someone who is contemplating suicide or not. And I've heard this many times, but I want to kind of tease it out and explain it to you a little bit. I've had many clients say to me, "Hey, I just don't feel like living anymore," or "I'm tired of living," or "I'm tired of this life. How I wish I would just die and get this over with." You know, this is this is shaky ground for those who are inexperienced. Okay, have them explain their thoughts to you and listen and ask them exactly what they mean. Don't I don't want to get ahead. Just listen to them. Okay, then you can ask the question: are you planning on killing yourself? No matter the answer, if they say no, no matter the answer, please hand them off to somebody. Only qualified mental health experts can adequately assess somebody or someone. But there's a kicker. Uh, we always don't get it right. I mean, we don't. So please do not blow off those seemingly innocuous statements. And I was thinking about telling you a story where uh, the some deputies were wanting to go admit somebody, and I intervened because they really weren't in the throes. They were talking in this sort of innocuous sort of way, as I don't want to live anymore. So just and they were doing their job, but I got called, so I was able to intervene because she was a client, and and I know they didn't say they were going to kill themselves. I understand that, but this is typically the beginning of a planned or what I labeled a philosophical suicide. There may be some underlying mental health issues brewing. It's the start of what we call psychache, or it could be prodromal or active in that state. Prodromal is like here's the start of it, and prodromal's in between, and then it gets in the active state of suicide. So prodromal is that uh, in between state. Okay, and psychache is is a moderate to extreme psychological pain. And it underlies a brewing crisis. It can be either physical or emotional pain, or it can be a combination, which the person believes, is intolerable, inescapable, and, interminable. This is a person who has the inability, or for some other reason, they cannot express themselves verbally to others. And what they do is they transfer their emotive pressure, storing all this ache in their internal states, okay, psychic. Uh, if they can't speak it when it needs to be said, then they will express it or act on it in unsavory and pathological ways. So we'll see that behavior from that, if they don't have that ability to communicate it, which was one of the three, if you remember, what's going on with them. So, again, I want to emphasize the importance of not minimizing any suggestions or statements provided by the individual. Acknowledge their state, validate what you hear, and connect. Connection, connection, connection. See if someone's considering suicide. You know, do that. And if they are, they're engaging in what we call selective abstraction. Okay. It's they are using these rigid filters to make negative generalizations about the world and about themselves. There's this disconnect between what is real and what is perceived. So selective abstraction is part of what I just said, but it's also, to explain it further, even though death is all around us and as a way of life, it's abstract to us, okay, for those who are still living. Those alive do not know what it's like to be dead. So it's abstractive thinking, and it's very selective, very rigid in the way they think. But to the person thinking about it, you know, it does no good to offer solutions to their problems. Just connect and listen. People that are in this state of rigid abstraction are contrary by nature, meaning they will overcome any argument any argument that's proposed, thereby defending their state of psyche. Okay, they'll defend it, even though it hurts so bad. That's just the humanness about it. We as our biological beings, we're aversive to pain, be it physical, psychological, or emotional. And we'll do almost anything in our power to rid or to reduce it. So, we take matters in our own hands, literally, in that. So that's I wanted to cover psyche and explain that and what selective abstraction means. And so you just got to listen, actively listen, and be engaged and connect. Don't try to offer solutions for them to fix their problem because they're going to shoot you down. Okay. Now, okay. Here are some indicators. Indicators that we should look out for. These are foundational indicators, which I've been talking about. In people's lives, meaning they're contained in the person's being or makeup, in that sense. I'm going to repeat this again, and we call it the deadly triad for suicide. And I've mentioned two earlier, but I'm going to cover them again. And they're major depression, okay, along with what we call a type B personality disorder. And along with that, there's this excessive substance or alcohol use. Now, for some, the type B personality disorders are new for some of you out there listening. So I encourage you to go back and watch my vlog on narcissism, borderline, histrionic, and antisocial personalities. That's what we call the cluster B. To get an understanding of the type B personalities, those disorders. And, what we see from those people suffering from cluster B, type B personality disorders is both this extreme substance, alcohol use, and depressive disorders, especially borderline sufferers, borderline, histrionic, narcissistic, antisocial. So in the borderline sufferers, for that. So we'll see the substance use. Now for substances, these substances are what we call agonists. They promote GABA, that neurotransmitter in our brain, that gamma GABA, gamma aminobutyric acid. Now you know why we just said GABA. So with alcohol and benzodiazepines, benzodiazepines are common ones. Are like Xanax, Ativan, Valium. They seem to correlate stronger with suicide than someone who uses opioids, amphetamines, which is a stimulant, cocaine's a stimulant, or some hallucinogenics. So if you know somebody's on Xanax or Valium or Ativan or even I'd include Klonopin in that. Okay, just keep an eye on them. And if a lot of people will use alcohol along with that. The dark triad, the three. type B personality, substance, alcohol abuse, and then depression. Okay, and remember those four. Please remember those four criteria for depression. Those are the most important. So a person, with a mental health disorder comprises 90% of those who commit suicide, and the risk of suicide is 38 times more likely for someone who's had a previous attempt. So I'm getting back to, those factors and indicators again. I really want to cover this foundational type before we get into specific behavioral signs. Okay, what's driving their life, what's their life part of. Most will take who have attempted suicide. Most within a year will take their lives after a failed attempt. Yeah, but there are two sides to this. Okay, the first group may become angry and upset, that they can't kill themselves adequately and they fail. And this is a really baleful sign. This is a dark sign. Okay. Now, a smaller group, having attempted it and failing, they're going to get some relief from the attempt. Okay. I remember I told you that I had mentioned how we're in this state of being really stressed and a lot of anxiety and can only last for so long. And what we do, we keep having them putting off day to day. Okay. So they'll get a relief from that, from all that stress of coming to that decision to commit suicide. They fail and they survive. And they may see it as a divine intervention, a divine act, or maybe even a sign, for renewed purpose in their life. Okay. So there's a different slant here. Let's see. And there's evidence that's accumulating to support this view. And this has to do with a personality type, and it's a rigid personality type. And I haven't covered this yet. That's my next series. I'll be doing it. It's, this personality type is like someone conditioned with this obsessional compulsive personality disorder, what we call OCPD. Now that's different than OCD, okay? And I'll explain it later on in really great depth in my next blog. But people with this obsessive compulsive personality disorder, they think in an all or nothing, black or white, what we call this dichotomous pattern, okay? Splitting. It's either good, bad, black, white, right, wrong. There's no in between ground, and we see this a lot again. In those with a borderline personality disorder, they fail to see the alternatives, and they can't grab what we call dialectics, which is basically living with two opposing views. They have these two opposing views, but we're going to accept that paradox. And for borderline and histrionic, we use dialectical behavior therapy, to treat both those two, histrionic and borderline, because I described histrionic as borderline personality, BPD light, in that respect. Okay, so for that, before I pretty much get into these known signs here, you can find with a few mouse clicks. I want to include something that's not talked about in relation to suicide. We say mental health a lot, but that's trauma. Okay. 23 veterans a day take their life by suicide, and that's followed by 8 a day from law enforcement officers. Other emergency responders, they also have higher statistical strength and weight than the general population. And these demographics, these people in these jobs, in these careers, they're exposed to traumatic instances daily. it's well known that many from these groups, they don't seek professional help. Okay, they don't seek help to process these internalized events. There's a there's a direct correlation between trauma and suicide, but in the research I did, it wasn't that robust. Okay, uh, and the statistical studies for me, they don't indicate such. But I think what has happened, what might be the reason is that they sort of bury it, they subsume it into this mental health patients and clients, that have suffered at the hands of unprocessed and buried trauma. So instead of saying trauma, somebody who has different types of trauma, complex, PTSD, acute, what they're going to do is they're going to subsume that up in under the heading of mental health. Now, I'm going to tell you, most people with mental health disorders, 84% have, indicated trauma, some form of trauma in their lives. So, I encourage you to go back to the vlog on trauma and my blog and get a deeper view. Uh, there are some other things in trauma I kind of want to say that we don't really see. We make it may be a little disenfranchised for some, but things like academic failure, you know, job or income loss or income difficulties. There's continued bullying, whether it's online or face to face. These are signs now. I'm kind of getting ahead a little bit that underlie a movement toward taking one's life. It's traumatic to them. Bullying or social castigation, it's a really important flag with adolescents. And sometimes we will see this spontaneous or impulsive suicide that concern relation difficulties or rejection. Okay. I'm doing pretty good staying with my notes. I haven't got ahead yet. Well, I did a couple times. So, psychological research assumes this suicide analysis underneath the banner of mental health and these mental health afflictions, and it takes into account trauma. Okay, but I think there is a really this very robust correlation between trauma and suicide. And I think it pretty much goes without saying that trauma, suicidal acts, thoughts, or behaviors, they go hand in hand with each other. Just remember that those that have been released within the last 30 days from a residential psychological care or program, they have a statistical increase of 300% to attempt suicide from the general population. Okay, and for those men in that, they're 3.5 times more likely to complete it because of the lethal means. So, all right, now we're going to get into these signs that I call triggers. Okay, and triggers, they become they become a source of concern when we feel someone is in that state of suicide, whether environmentally or hereditarily, they're predilected for suicide. Okay, they have a proclivity for suicide, preponderance, all these P's. So a recent stressor or sudden catastrophic event, leaves someone feeling very desperate at a tipping point, a trigger. So, what we've covered, I kind of want to explain this probably more for me in my mind than you, but what we've covered so far, they can be considered those foundational issues. It's kind of this fecundant soil. It's very rich soil that will germinate this proclivity for suicide. And the triggers are seeds. We can say it's seeds being scattered or placed upon that soil. Okay, so I hope that really clears the differences between the foundational settings and this proverbial straw that broke the camel's back. The trigger. Okay. I told you it's all about connection. So I think one of the biggest trigger signs is relationship triggers. Which are basically difficulties or relationship disappointments that are signs to be alert for. In the literature, we really don't see this because they don't say relationship. There's a lot can go into relationship, but they list it as separations, divorce, and death, or some other instances of relationship breakup. Anytime there's some sort of difficult problem to deal with inside of relationships, it becomes a warning sign for us to be attuned for these drastic measures that may occur. So, also, with deaths in the family and the fact that the death was caused by suicide, it adds a 5-fold likelihood of suicidal behaviors from close survivors. So now this may correlate to a genetic predisposition, but it's not quite teased out accurately to indicate whether it was from environmental experiences, that loved one taking their life, or it's actually a genetic influence. So, they haven't really isolated in the genetic code the specific gene sets for that. And, when I've looked at, I've got this, I don't have it here. I looked at what we call it's a scale that measures life event stressors. Okay. And the top three, they have to do with relationship, their death of a spouse, a divorce, and marital separation. Now, we as psychologists, we would include any cohabitation that are of intimate origins as being along the same lines as spousal loss. These aforementioned items, they reflect, again, either a communication, a control, or an avoiding reason for suicide. Another trigger is overwhelming medical diagnoses or prognoses. Okay, diagnoses, plural. Prognosis, plural. Okay. Now these may or may not be fatal, but nonetheless, the thought of prolonged pain and suffering may serve as that final trigger. Basically, to them, this is a loss of quality of life concerns. It's a good way to frame this trigger, I think, in this medical sense. Now, not just for them, this diagnosis or prognosis, it can also be for a loved one who receives it, like dementia, Alzheimer's type, dementia Lewy body, dementia Parkinsonianism, dementia frontotemporal lobe, or other brain lesions, okay? Like ALS, we call it Lou Gehrig's, multiple sclerosis, multiple dystrophy. And in this, may include this suicide, homicide, or suicide act, okay? So be attuned to that for that. Now, you know, I thought about people who they have to have an extended use of a colostomy bag, or that, or the inability to eliminate in a normal manner. This is a loss of quality of life. So we can include that. Having to take repeated shots, dialysis, okay, chronic pain, pricking one's finger can cause stress amount, sexual dysfunction. Yeah, for some guys, that may become emasculating. It may be the last straw. That may be a loss of quality of life for them. Okay, so there are so many medically associated triggers, and I'm sure that some of y'all can probably think of some that I haven't mentioned. Okay. A trigger not specifically addressed in the literature is something that I consider a loss, or a change in support networks. It's a loss. It's this change in support networks is what I'm trying to say. You really won't see that if you go in and look, but I'm going to say some things that you may not find if you research it. So, retirement is an example, okay, where one can lose that day-to-day meaning in their lives. A change of employment from one that was satisfying to one that's considered, burdensome, demeaning, or even a change in work responsibilities. And it can go the other way. Maybe someone's promoted into a position that is too much pressure and just too much stress, okay, for that. Another social network change is loss of social network is a change in residence, especially for adolescents who have to kind of start over, where they lose their friends and have to go to new schools and around new groups of peers, and they face rejection or ostracization. Okay, they're ostracized in that. Church. So a loss or a dramatic change of church or congregant membership. That maybe someone was asked to leave or booted out for behavioral indiscretions. I've seen that happen. This it changes one's comfort zone, and it's diurnal predictability of everything. And these stressors, they can overwhelm in that. Okay, financial loss, the loss of property, houses, land, cars, businesses. Now, I got down here, and this is really isn't property. Loved animals. Okay, the loss of those, that stressor, the last straw. They can't take it anymore. Maybe their life was consumed around taking care of their animals, and they've lost their animals. I was a lady. She had several horses, beautiful horses, in the barn. The barn burned. And it really the story on that. And this, it can all be a shock to the system. Okay, and that. So bankruptcies, repossessions caused by these economic fluctuations. And it also can be caused by relationship changes, getting back to medical expenses, or employment changes, and is another component in the list of triggering events. You lose income because you change jobs or change employment, okay? So these are triggering events. And the loss of possessions, it can be by weather, fire, or accidental occurrence. It can be that final straw. So, in a general sense, and speaking, in a general sense, loss of status, loss of relationship, financial standing, loss of friends, social circles, faith organizations, health, and work positions. Okay, those are kind of something that is very stressful in those environments can be the last straw. So I want to change our focus here and not so much look at stressors, but behaviors or actions that are noticeable in those that we're familiar with. Let's say there's this morbid fascination with death. Like they talk about it, they write about it, or even draw pictures about death. It may indicate a thought process that can lead to killing oneself. Feelings of worthlessness, hopelessness, feelings of being a burden, or a lack of a sustained meaning in life. They're all warning signs. Okay, feelings of being trapped. Being trapped in life, being stuck in life. Extreme mood swings, from happy to sad, sad to happy. What we call cycling. That's another sign. When someone who seemed severely in the dumps, what we might say depressed, but overnight has this, you see them in their calm, almost this serene disposition. This can indicate that they've made a decision to take their life. So, look for that. It's just sort of a hint there that I'm giving you. Okay. When they start settling outstanding affairs that they've had, giving away prized possessions, maybe the reorganization or a brand new submission for a personal will, or even, taking care of unfinished business. This can and should raise concern and draw attention. It could be a comment like, hey, if something happens to me, do this, or, this is located here. Now, if someone you were close to at one time, but let's say something happened to separate you two, if they from, like out of the blue, try and sort things straight, this could signal someone setting their affairs in order. It's what we call making amends for past indiscretions or hurts, okay? So another one is someone who they never seemed impulsive before. They start taking dangerous and unnecessary chances in that. They drive fast, overspending, they become promiscuous, they start gambling, or things that seem not in the person's nature, things that are beyond their adventurous self. World trip, things they consider, on their bucket list. Okay. So, in this world of prevention that we have, we want to find, first and foremost, connection is what we want to do. We want to find that and connect with them. We search for it. And then we validate what they think, what they feel, or what they say. Now, do not try and solve their worries, and do not offer solutions. Like I said, it's hard to overcome their objections, and they're going to staunchly defend their position. Telling someone to get over it, put it out of their head, or things will get better. Those don't work. They just create this wall between you and them. Okay. Let them know that you hear them, you see them, you feel them. Then, hand them off to a professional. I've got this note here, and I'm going to say it. I'm sorry to say it, general practitioners, general doctors, physicians, medical doctors, even some clergy, they're not equipped to handle such extreme situations. So, use that toll-free number that you were given, 800-273-8255, and call the crisis hotline for them. Okay, if you can't get them handed off, call that crisis hotline. Okay. If you can safely remove lethal means, do so. Okay. there's some things you got to think about. So if you're handling controlled substances, firearms, make sure someone knows the reason it's in your possession, okay? And that. So, hey, that's basically the essential elements of prevention, what I wanted to talk about. There are structured programs out there that we can all attend and learn, and we can learn to practice these strategies and techniques. They're out there. Just type in suicide training in my area, and a lot of places, even here in Northeast Alabama, have these workshops, these 2-day, 1-day workshops. Okay. So Maranatha, everyone, and if you need to get a hold of me, it is 256-599-0291. And I want to say Maranatha and good night. Okay. Thanks for tuning in.